Yeah, so this year at GU ASCO 2024, we have a late-breaking abstract on the adjuvant ambassador study of adjuvant pembrolizumab versus observation in patients with muscle-invasive urothelial carcinoma. The Alliance Ambassador Study is a multi-center study, phase 3 trial, open label, where adjuvant pembrolizumab for 1 year is given to patients with muscle-invasive urothelial carcinoma versus observation. The key eligibility included patients that had muscle-invasive urothelial carcinoma, and this can be bladder, urethra, renal pelvis, or upper tract. The patients could have received neoadjuvant chemotherapy. If they did, they had to be PT2 or greater, lymph node positive disease, or have positive margins, or they could have been cisplatin ineligible. In that case, they should have been PT3 or greater positive margins or positive lymph nodes. The patient must have had radical surgery within 4 to 16 weeks of enrollment into the trial. The study stratified patients based on PD-L1 status, whether they received neoadjuvant chemotherapy, and their pathologic stage. And it was a dual primary endpoint of disease-free survival and overall survival. And key secondary endpoints included PD-L1 status and DFS and OS. So the study was positive for one of the dual primary endpoints, and the way that the study was designed is if it's positive for one endpoint, one primary endpoint, the study is overall positive. Adjuvant pembrolizumab improved disease-free survival versus observation with median disease-free survival of 29 months versus 14 months for the patients in the observation arm. And this was regardless of PD-L1 status, with a hazard ratio of 0.69 and a median follow-up of 22 months. We also looked at overall survival, and this was an interim analysis of the overall survival, and it did not meet the pre-specified cutoff for improvement in overall survival, but this was immature. The data is still maturing for final analysis. We see that adjuvant pembrolizumab is very active, and it's a treatment option for our patients now with muscle-invasive urothelial carcinoma in the adjuvant setting that are at high risk. So I think that these findings are very exciting and offering a new treatment option for our patients in this setting.